Ever wonder why your doctor often requests a complete blood count during your checkups? Well, there's a fascinating reason behind this. Picture your body as a bustling metropolis. Just like a city, our body needs a swift and efficient system to transport vital substances to every corner. This is where blood comes in, acting as our body's internal highway. Blood is a dynamic fluid, always on the move. It carries oxygen from the lungs to every cell in the body. It transports nutrients from the food we eat to nourish these cells. And just as importantly, it picks up waste materials from our cells and delivers them to the organs responsible for their disposal. But that's not all. Our blood also houses an army of warriors ready to defend our body against invading germs. Yes, we're talking about our blood cells. They might be microscopic, but they're mighty. They keep us alive and healthy, fighting off infections, healing injuries, and performing countless other crucial tasks. But how can we tell if these unseen warriors are in good shape? This is where a complete blood count, or CBC, comes in. It's a common blood test that gives us a snapshot of the health of our blood cells. It measures the three types of cells in our blood: red blood cells, white blood cells, and platelets. Each of these cells has a different job to do, and their number and health can tell us a lot about our overall health. For instance, a high or low red blood cell count can indicate a variety of conditions, from anemia to dehydration. The number of white blood cells can signal an infection or an immune system disorder, and the amount of platelets can hint at a bleeding disorder or an issue with bone marrow. So, a complete blood count is your doctor's way of checking the health of your unseen warriors, your blood cells. They might be out of sight, but they're certainly not out of mind, especially when it comes to protecting and maintaining our health. But what exactly does a complete blood count measure, you might ask? In essence, a complete blood count, or CBC for short, is a comprehensive measure of the three main types of cells flowing through your veins: the red blood cells, white blood cells, and platelets. Each of these cells plays a unique and crucial role in the functioning of your body. Let's start with red blood cells, the most abundant cells in your blood. These are the body's delivery system, responsible for carrying oxygen from your lungs to every part of your body. Just like a postal worker tirelessly delivering mail, red blood cells ensure that each cell in your body receives the oxygen it needs to function optimally. Next up, we have the white blood cells, the body's defense force. Think of them as your body's military personnel, always on guard, ready to fight off intruders. They're the ones that step up when your body is under attack from viruses, bacteria, and other harmful substances. They might be fewer in number compared to red blood cells, but they play a significant role in keeping us healthy. Last but not least, we have the platelets, the peacemakers of the body. They prevent internal wars by ensuring that our blood clots properly. Whenever you get a cut or a bruise, it's the platelets that rush to the scene, sticking together to form a clot and prevent excessive bleeding. They are like the paramedics of your body, always ready to jump into action when there's an emergency. In summary, a complete blood count measures these three types of cells. It provides a snapshot of your health by offering insight into how well your body can transport oxygen, defend against disease, and heal wounds. Therefore, a complete blood count is essentially a roll call for your red cells, white cells, and platelets. So, what's the big deal about these numbers anyway? Well, let's dive into that. These numbers we've been talking about, they're not just random figures, they are in fact a vital part of the story that your blood tells about your health. They serve as the key indicators, shedding light on the complex narrative of your body's inner workings. Let's imagine, for instance, that your red blood cell count is lower than the normal range. This could suggest that you might be dealing with anemia, a condition that leaves you feeling tired and weak because your cells aren't getting the oxygen they need. On the other hand, if your white blood cell count is shooting through the roof, it's like a red flag being raised. This could be a sign of an infection, as your body ramps up its defense forces to fight off the invaders. Alternatively, it could also hint at an autoimmune disease, where your body mistakenly attacks its own cells, or even a bone marrow disease. Now let's talk platelets. If these little clot-forming cells are fewer than they should be, you might be at risk of excessive bleeding, even from a minor injury. On the flip side, an abnormally high count could mean that your blood is clotting too much, putting you at risk of developing blood clots in your veins or arteries. And here's the thing, sometimes it's not just about one number. If multiple numbers are off kilter, it could even suggest something more serious like cancer. So you see, these numbers aren't just numbers. They're signals, they're warnings, they're markers of potential issues that might be brewing beneath the surface. They're a statistical snapshot of your health, a quantitative reflection of your well-being. Hence, the numbers from a complete blood count can be crucial clues to your overall health status. It's not just about the numbers, it's about what they signify, what they represent, and most importantly, what they can reveal about the state of your health. So when should one get a complete blood count, you may wonder? The answer, quite simply, varies. For starters, a complete blood count, or CBC, is often part of a routine checkup. It's like a regular report card for your health. Doctors use it to get a snapshot of your overall well-being, checking for any variations in blood cell levels that could indicate a potential problem. It's a standard procedure, and you may have had one without even knowing it. But routine checkups aren't the only time a CBC may be ordered. If you've been feeling under the weather, experiencing symptoms like unusual fatigue, unexplained weight loss, or persistent fever, your doctor may order a CBC. These symptoms might be your body's way of signaling a problem, and a CBC can provide crucial insights. By looking at the number, size, and shape of different types of blood cells, medical professionals can detect a range of conditions from anemia and infections to blood cancers. Now let's say you already know you have a health condition. Maybe it's diabetes, heart disease, or a kidney disorder. In such cases, a CBC becomes an essential tool for monitoring your health. It helps doctors keep track of how your body is responding to treatment and whether any adjustments need to be made. A regular CBC can even reveal if a seemingly unrelated issue is affecting your condition. Sometimes a CBC is ordered before a major surgery or procedure. It's like a pre-flight check for your body. This helps ensure that you're in the best possible shape to undergo the procedure and recover successfully. In essence, a complete blood count is a versatile tool in the doctor's diagnostic toolbox. It's a simple test, yet it provides a wealth of information about your health. So the next time your doctor orders a CBC, remember it's all part of ensuring you're in the best health possible. Now that we understand the value of a complete blood count, what's next? Well, it's all about taking that knowledge and putting it into action. The power of prevention and early detection cannot be overstated. Just like a well-oiled machine, our body needs regular checkups to ensure everything is running smoothly. Imagine your body as a complex, intricate machine. The complete blood count, or CBC, acts like a detailed report card, providing insight into how well this machine is functioning. And, just like you'd want to know if your car needs an oil change or new tires, you'd also want to know if your body needs attention. Regular health checkups are not just for when you feel unwell. They are a proactive tool, a preventive measure to keep your health in check. When you have regular checkups, your doctor can compare your CBC results over time, spotting any trends or changes that may be cause for concern. Now let's talk about early detection. In many cases, diseases don't show symptoms until they've progressed significantly. This is where tests like CBC come into play. They can help identify potential problems before they become serious. Think of it as a smoke detector alerting you to potential fires before they become uncontrollable. Early detection through tests like CBC can lead to more effective treatment and better health outcomes. It's like catching that small leak in your roof before it becomes a full-blown flood. So, what's the takeaway here? It's simple. Regular health checkups, including CBC, are an essential part of staying healthy. They help detect potential issues early, giving you the best chance of successful treatment. Investing in your health through preventive measures is not just about adding years to your life, but also about adding life to your years. It's about living fully, not just living longer. Remember, a complete blood count is more than just a test. It's a powerful ally in your journey towards good health.